Welcome back, everyone, from our final break of the day and to our final session of day 4. Our overview of CRAN's resources and programs with our very own Cassandra Macaulay, our Chief Research Officer here at CRAN. Cassandra is the Chief Research Officer at the Colorectal Cancer Resource and Action Network. She leads and contributes to CRAN's patient-focused and evidence-based initiatives to provide support, education, and advocacy for colorectal cancer and other tumor-type patients and caregivers, as well as those at risk of developing the disease. Cassandra has a clinical background as a medical radiation technologist, in addition to a graduate degree in health science or health studies and leadership. She has worked in both patient-facing and project management roles and led the startup of 2 nuclear medicine programs, which improved access to diagnostic imaging in her community. She is passionate about health quality and improving the patient experience, and is honored to have the privilege of supporting, educating, and advocating on behalf of cancer patients. I will also add very quickly, she's an amazingly supportive and wonderful colleague. So I'm happy to pass it to you, Cassandra.
Thanks so much, Chris. I really appreciate the introduction there. So as Chris has shared, I'm going to just be kind of providing a general overview of the wonderful, wonderful resources and programs that CRAN has to offer. And I've had the privilege of engaging with and helping to lead over the past 3 years. Dr. Rafel is certainly a tough act to follow, but I will do my best to keep this engaging as the last session of the day. And I'll be fairly concise as well. I don't anticipate needing the entire 45 minutes here. So as we go through, I'll just speak to our team, get into our programming, as well as some of the upcoming events that we have following this summit. So I always like to start with our team. And, some of us you see a little bit more often than others on camera, but it really takes a absolutely dedicated and passionate team to be able to do the work that we do. And each and every one of our team members is so integral to our work, and to be able to provide the support, education, and advocacy for our team members, or for our patient community rather. And our team is full of just absolutely remarkable human beings who are so passionate about the work that they do and so dedicated to CRAN's mission. So a special shout out to our team. In terms of the patient support, myself and Philomena are commonly connecting with patients, as well as Christopher, Hamachi, and one of our newer team members, Dawn, is also supporting patients directly. So CRAN has quite a wide depth and breadth of patient-focused and evidence-based programming available. I will note that these programs are available to both patients and caregivers, or family members of those impacted by the disease. In addition to all of these programs and all of these resources, our patient support team is available for one-on-one patient calls, and we have some wonderful educational content on the website as well. So what I'll be doing today, this afternoon, is just walking through some of the details of each one of these programs and resources, so you can have a better idea of what ones might be helpful for you. So starting with my colorectal cancer consultant, this is an absolutely wonderful program. And what it is it's a biomarker informed online tool, and it's been designed for the metastatic colorectal cancer patient or their caregiver. And the idea of this tool is to really encourage informed and joint decision making between the patient and their treating oncologist. So this tool is available on our website in both English and French, and patients just require a copy of their pathology report, so their NGS report, their CGP report, it goes by different names, But what we're looking for with this tool is using your biomarker information. So remember that biomarkers are like a genetic fingerprint of the cancer, and they identify what mutations might be driving the tumor. So we take that information, the biomarker status and the tumor characteristics. You go into this online tool and you answer a series of simple questions based on the information in that report. And what this tool does is it actually produces a personalized report. And that personalized report outlines potential treatment options, so potential drug therapies or systemic therapies that might be appropriate for each individual patient based on their tumor's biomarker status and characteristics. So this is an awesome educational tool. We really believe, an educated patient is an empowered patient, and this is a great step for metastatic patients to take to better understand their potential drug therapy options. As we heard in the last session and some previous sessions leading up to this, the treatment landscape is changing rapidly for colorectal cancer. So this tool actually gets updated each and every year because things are changing so quickly, which is a wonderful thing. The My Colorectal Cancer Consultant is reviewed annually and endorsed by clinical experts, and it's updated based on clinical practice guidelines to ensure that it really remains relevant and accurate each year. Our second online tool that is available is called My Colorectal Cancer Treatment Side Effects. This is another educational-based tool. And for this tool, again, users are going online, they're answering a series of online questions, and it's designed for patients who are, or even patients who will be undergoing a drug therapy, so systemic therapy. And through this tool, patients are able to gain information on the colorectal cancer therapy that is of relevance to them. So with this online tool, users get to learn about not only what the side effect is, but more importantly about the potential prevention strategies and remedies that might be available to help manage that side effect. Again, it's all about empowerment and education. And, by better understanding the side effect, by better understanding, the cause of the side effects, the symptoms, the remedies, and the treatments, our hope is that this tool may help patients to perhaps avoid a visit to the emergency department. Maybe having this information can help patients to avoid a hospital admission or reducing your dose or even having to stop that treatment altogether. Similarly to the My Colorectal Cancer Consultant, this tool has been reviewed and endorsed by clinical experts as well as a pharmacy expert to ensure its accuracy. We know that when patients are accessing information online, it can be a challenge to find reputable information. And it's been very important to us as we bring these tools forward, these online tools, that the information is very much based in evidence and up to date. So our My Foods for Life program, it provides an overview of lifestyle recommendations to help reduce the risk of developing cancer. But it also provides recommendations to follow after a cancer diagnosis. And the recommendations that are issued through this program are largely based around up-to-date guidelines surrounding nutrition and cancer, for example, from the American Institute for Cancer Research and the World Cancer Research Fund. In this program, CRAN has our very own National Registered Dietitian, Felicia. Felicia presented earlier in the summit, and she is available to assist our patients with one-on-one nutritional guidelines to really support them through their cancer journey, to help them, optimize their symptom management and really optimize their body's ability to fight the cancer and to better tolerate their treatments. So we know that access to a registered dietitian is a gap in the healthcare system throughout our country. Some patients are able to get varying levels of access to a registered dietitian through their cancer center. Some are not. And this program is really designed to meet that unmet need and fill that gap. And it's a wonderful program. And Felicia is just awesome at supporting patients and really meeting them where they're at in terms of making recommendations that are attainable and realistic for each person at an individual kind of personalized level. So my early age onset colorectal cancer hub. So first of all, I'll just start off by sharing that CRAN has a mandate dedicated to addressing the rising rates of colorectal cancer in the early age onset population. And when we talk about early age onset cancers, we're talking about cancers that are diagnosed before the age of 50. In colorectal cancer, rates of early age onset cancer are rising at a really, really alarming rate. So unfortunately, the proportion of patients that fall into this category is continuing to grow. And CRAN's work is so focused on this, so much so that we host an annual symposia series dedicated entirely to this population. I'll speak a little bit more about that in the coming slides. But in response to those many unmet needs that are apparent with younger individuals diagnosed with cancer, CRAN has developed this My Early Age Onset Colorectal Cancer Hub. And it's really designed to provide online resources and a sense of community for this part of the colorectal cancer population. So the hub includes things like evidence-based information on the disease that's really tailored to the specific and unique needs of individuals under the age of 50 who are living with colorectal cancer. The hub also contains information on Sunnybrook's Young Adult Colorectal Cancer Clinic, which is really a young, one-of-a-kind clinic in Ontario dedicated to multidisciplinary care, meeting the unique and diverse needs of this patient population group. The hub also includes access to CRAN's support chatbot. So the support chatbot is moderated by CRAN, and through the chatbot, users can actually have access to experts right across the continuum of colorectal cancer care and actually have the opportunity to ask a question of our medical advisory board. The CRAN staff will triage those questions and make sure they're responded to in a timely fashion and assign it to the medical advisory board member that is of most relevance to the question. And then additionally, visitors to the hub have access to, some really wonderful stories and testimonials of the brave fighters within our network who are so inspirational and can provide so much encouragement to others newly diagnosed with colorectal cancer at a young age. So overall, the hub here provides a platform really to promote best practices in early age onset colorectal cancer detection, diagnosis, and care. It helps to facilitate expert and patient collaboration, and we do so through things like working groups, through the symposia series, and through the development of various patient tools. Moving now to some more of our support-based programs. So I started out kind of more about the educational-based programs. I'll switch gears and speak a little bit more to the support programs. So My Cancer Companion is actually CRAN's newest program. It is our first program that is being expanded across cancer types, although the initial focus of this program is most certainly within colorectal cancer. And what it is it's a peer-to-peer support program. Now, something we know about peer-to-peer support is that it is mutually empowering, and it's an experience that enhances the ability to cope with the diagnosis, the treatments that come along with that. It improves perceived sense of control, and it helps individuals also to develop some self-management skills. But the other thing we know about peer support is that it can actually be more effective when participants are able to connect with someone who has, similar demographics, similar disease characteristics, and importantly, similar life experiences. As essentially someone in whom each peer is able to see a bit of a reflection of themselves. And those shared commonalities enhance the benefits both received and given through peer support. So through My Cancer Companion, individuals who are interested in receiving or giving peer support will go through and they will register using a number of metrics. And the support seekers are actually able to identify what metric, and some of them you can see there on the screen, but able to identify what metric is most important to them. So through this program, we do a really tailored high level of matching based on the unique needs of each individual. And as an example, somebody might say, I'd really like to connect with somebody who has kids the same age as me who's going through this. Or, I'd really like to connect with someone from the same sexual orientation or who speaks the same first language as I am. Whereas others might want to connect with somebody who lives in the same town as them. And the unique thing about this program is that the individual seeking support can tell us through their registration what's important to them, and we can make those matches accordingly. CRAN's, my monthly information and support group meetings. So this is where CRAN started all the way back in 2006 when Philomena first brought CRAN to light, and this has been the mainstay of our organization for the past 20 years, hosting these monthly support and information group meetings. And they're held virtually and are national in scope. And through these meetings, we provide updates on monthly clinical research and treatment. We facilitate expert presentations, and we provide an opportunity for patients and caregivers to be able to share and really connect with one another and learn from each other's experiences. Since our membership is growing, we have started to stratify the support group meetings. Most often we stratify by age. So we'll have a group for the under 50 patient population as well as the over 50 folks. And sometimes we will stratify based on stage of disease as well. And we've done that because we believe that stratifying the groups really allows more time to adequately address the unique needs of each one of those groups. So absolutely, if you are a patient or a caregiver going through a colorectal cancer diagnosis and treatment or survivorship, or if you know somebody else who is living with this, you're absolutely not alone. We have a whole community that you can connect with through these meetings and our other resources. And I can say from participating in these meetings for the last few years that they tend to be such a place of hope and connection and sharing. And people tend to leave these meetings, I think, feeling a little bit better than perhaps when they had joined, and a wonderful resource for evidence-based information as well. CRAN also provides its members with monthly research and treatment updates. And we do so by performing a comprehensive review of the literature each month. And then we translate this into a plain language document that is a little bit more digestible than sometimes reviewing much of the scientific literature on your own. And the updates are broken down into various headings, so including things like drugs or systemic therapies. That's probably the biggest part of the updates. But we also talk about things like surgical therapies, radiation therapy, screening, early age onset cancer, nutrition and healthy lifestyle, and other categories to make sure that we're comprehensively updating on everything that is really relevant across the continuum of colorectal cancer care in terms of what's new. And finally, I wanted to save this one for last, our My Colorectal Cancer Coach program. So our absolutely amazing, wonderful coaches are all with us and training and certifying through this summit. And they're absolutely amazing individuals. So I'll talk a little bit about this program. So what it is it's a peer-to-peer support and education program, which makes it quite unique. So through this program, patients and caregivers are matched to a cancer coach. And these cancer coaches journey with the patient. They help them to navigate the challenges ahead, and they provide one-on-one support and evidence-based information. So these coaches, these wonderful coaches who are with us through the summit, are volunteers, and they complete this annual mandatory training and certification. And a large part of it is this event that we're hosting this week. And as you know, if you've been following along, the training is right across the whole continuum of colorectal cancer care. So our coaches have a really high level of content acumen to be able to very thoughtfully address the inquiries that they receive in an evidence-based manner. Our coaches are also individuals who have lived experience. So they bring with them a lot of compassion and a lot of understanding and a lot of insights in having lived with this disease, either as a patient or as a caregiver. This unique combination of compassionate support and evidence-based information, I think, is what makes this program really, really unique and really wonderful. And I can't say enough amazing things about our coaches because they give so much of themselves, and they dedicate so much time and so much effort and just bandwidth to this program, not only throughout this training week, but throughout the year. And I've heard so many wonderful stories from other patients and caregivers about how much the coach program has meant to them, and how impactful it has been in ameliorating their own cancer journeys. So I really want to take the time to thank our coaches for the amazing work that they do. Each one of our coaches does represent a specialized portfolio, and that portfolio is based on their own lived experiences. And that's done to ensure that their expertise as a team addresses the many, many needs of the colorectal cancer journey. So I'll leave the programs and resources part of the presentation here with the coach program as our final one. And then I just want to touch on some upcoming events that CRAN is hosting throughout the balance of the year. First of all is Bum Run. So Bum Run is our national 5K family-friendly walk run event. It's hosted live in Toronto, Calgary, Halifax, and Vancouver, and also runs virtually throughout up until May 31st. So I've spent a lot of time talking about our programs and how wonderful they are. And it certainly takes the passion and the heart of our CRAN staff and our CRAN volunteers to be able to run these programs. But it does also take some funding as well. And Bum Run is our major fundraiser, and the funds raised through Bum Run go directly to CRAN's patient programs. So when you're participating in Bum Run, fundraising for Bum Run, you're directly supporting the colorectal cancer patients and caregivers accessing our programming throughout the country. Bum Run is also a really, really fun event to be able to raise awareness about colorectal cancer and come together as a community to support individuals who are living with this disease. The next event that I'd like to talk about is CRAN's Pan-Tumor Biomarker Conference Series. And it's an event that has very certainly evolved over the years. We started out identifying barriers and challenges to molecular testing and results and biomarker turnaround time. And as the event has evolved, we're now talking about how we can proceed towards a national strategy for advancing comprehensive genomic profiling in metastatic cancer care in our 2006 event. So registration for this event is open. It is being held virtually June 18th to 19th, 2026. It's absolutely free of charge and open to a wide variety of audience members. We have some really wonderful experts coming in, and I'll speak in the next slide to some highlights. But I will mention as well that each and every year that we host the Biomarkers Conference, we actually capture the outcomes in a manuscript that is published in an international peer-reviewed medical journal. And that publication allows CRAN to add to our advocacy toolbox by generating additional evidence that we can reference when we're advocating for improvements to biomarker testing and access to comprehensive genomic profiling, when we're advocating to policymakers and decision makers across the healthcare ecosystem. So in terms of the conference itself, some of the topics of discussion will include things like talking about the impact of comprehensive genomic profiling. So again, that advanced large panel biomarker testing in the Canadian cancer care landscape. And we'll be looking at that across tumor types. We find that by bringing the tumor types together, we can be more effective in bringing together that collective resounding voice and really influencing change. We'll be hosting a national conversation on CGP becoming a standard of care and talking about system barriers that are impacting cares, including delays and access gaps. We'll host a session on bridging clinical trials and real-world genomics, trying to get the idea of research and care directly to patients and the bedside. And we'll talk about how we can leverage evidence, including the economic evidence that CRAN has recently generated, to support CGP implementation across our country. Finally, as the last event that I'd like to speak to, I will touch on our early age onset cancer symposia series. So again, this is dedicated to cancer, to individuals diagnosed with cancer before the age of 50. This event is hosted annually in November and addresses multiple tumor types in a similar fashion that our Biomarkers Conference does. Within this 2-day scientific symposia, which was done virtually, we will be talking about how early age cancer is impacting the way that cancer care is defined and treated in Canada. We will, of course, be talking about colorectal cancer screening. So CRAN has been actively advocating for a lowering of the colorectal cancer screening age for the past 6 years or so, really since our inception as a national incorporated organization. And we will continue those conversations, continue generating evidence to support our advocacy work through this symposia series. We'll also talk about how we can integrate comprehensive genomic profiling and other advanced types of diagnostic testing into early age onset clinical practice, and talk more about how we can bring more innovation and more research to young patients who are really looking to ensure that they leave no stone unturned in terms of exploring treatment options for the management of their disease. And much more. The agenda is still under development, and we're very excited to be bringing it together. So just a shout out to watch for this upcoming event in November 2026. We will certainly be sending out information as it approaches. And I will wrap up with that. So thank you very much for the opportunity to share these resources with you today. Certainly, any patient or caregiver watching who is interested in learning more, it would be our absolute privilege to be able to support and inform you throughout your journey. Please reach out to our team. You can reach out to myself, Philomena, Christopher, Hamachi, Dawn. Any one of our team members would be absolutely happy to support you and connect with you and help you navigate which programs and which resources might be the best fit for you. But there is an absolute abundance of support and an abundance of information that is available to you. And please know that you don't need to feel alone or feel isolated. And we've got so much available for support. So what we'll do now is I'll hand it back over to Christopher. Our cancer coaches are going to head behind the scenes to discuss the programs and resources and make sure we have a really good understanding of what's available. And Chris and Philomena are going to close out the day today. Over to you, Chris.
Thank you very much, Cassandra, for the always warm and informative overview of our relevant CRAN patient programs and resources to close out our day 4. As an early age onset cancer patient, I truly wish I had access to these kinds of resources, educational events, and tools earlier on in my journey. So they are absolutely amazing. And lastly, thank you, Cassandra, for all you do for patients, caregivers, and all of us coaches all year long as well. I'm going to share my screen now quickly. And just confirm everybody can see the screen okay? Perfect. As we like to do, we would like to close out with a quote. Cancer did not bring me to my knees, it brought me to my feet. And, that's such a powerful quote. Finding that internal strength and positivity can be so hard during a cancer journey. But just know out there that CRAN, our cancer coaches, are here to help you try to find a way, any way that we can. And all you ever have to do is reach out to us, and we'll do everything we possibly can to support your journey. So we're here to support always. Finally, I'm going to pass the floor back to our founder, CEO, President, Philomena Servideo Italiano to say goodnight.
Thanks very much, Chris. Hello again, my friends. Thank you for having joined us today. It was a riveting lineup of sessions delivering thought-provoking content on, for the most part, the management of metastatic colorectal cancer, which was made possible with the support of our sponsors, Natera, Pfizer, Taiho, and Masters Insurance. Thank you for your unwavering support. Today, we learned how liver metastases are being effectively treated and some of the newer clinical trials that are coming to pass for the management of metastatic disease, the role that ctDNA is playing in the management of colorectal cancer, how radiotherapies are effectively addressing metastatic disease, and how more and more naturopathic remedies are helping to address treatment-induced toxicities, along with the role that hyperthermia plays when undergoing systemic therapy. I do hope you enjoyed listening to our resources and programs and how those are supporting our patients and caregivers at CRAN. I invite you to tune into our 5th and final day tomorrow as we examine liver transplant, the surveillance phase, and the importance of exercise during the cancer journey. My very best to you all. Good night.